So, welcome to this class. This is a lecture on plastic surgery. This lecture is intended for the 6th semester students of the MBBS course. Normally, we have personal lectures, but because of the situation that has risen because of this outbreak, we are having this online lectures. It is my belief that these online lectures probably cannot replace our regular lectures, but then we really don't know when this epidemic is going to get over, and in the meanwhile we will have these online lectures, and we will try to see as early as possible when we can resume our regular personal lectures. So, in the meanwhile, here it is. So, as you know that for the 6th semester, most of the surgical lectures are lectures on specialties. You would have already had lectures on urology, pediatric surgery, and so on and so forth. So, continuing in that series, you will be having a couple of lectures on plastic surgery and a couple of lectures on thoracic surgery. So, let us start the class. First of all, what is plastic surgery? There is a lot of misconception about plastic surgery in the society. For most people, plastic surgery is the rhinoplasty or the nose job that Sri Devi got done way back in the 80s, where she got her nose corrected, or patients with pendulous abdomen having it tightened, a surgery known as abdominoplasty, or tummy tuck surgery. You would have heard of a lot of fat guys getting their fat sucked out of the abdomen, surgery very famous, known as the liposuction, or old ladies getting their wrinkle face stretched, surgery known as the facelift surgery. But plastic surgery is not really about these surgeries, and these are just a branch of plastic surgery, even though they are a very famous branch known as cosmetic surgery. So, plastic surgery is all about managing this kind of complicated wounds. You can see this patient has got his tibia exposed, bad RTA. Plastic surgeons help cover these kind of wounds. Patients with other types of trauma, you can see this child has got his hand, tendon and nerves cut, and repairing these comes under plastic surgery. This patient has got a large malignancy. Once the surgeon removes this breast, the patient will be left with a large wound, and they have to be covered. Plastic surgeons help cover these kind of large defects left by after oncological surgeries. And it's all about correcting this kind of gruesome cosmetic damages caused by diseases like here this patient is having anybody knows? Yes, this is plexiform neurofibromatosis. There was a famous movie called The Elephant Man in the early part of the 19th century is based on this. So, for correcting this kind of gross facial disfiguring facial conditions, this patient has got contractures, post-born contractures. You can see that her hands and the neck have completely gone into contracture. This patient can hardly lift her face or straighten her for their wrists. So, it's about correcting these deformities. In short, plastic surgery is not just about cosmetic surgery, which we saw on the first set of slides. It is about correcting complicated wounds that are produced by trauma or by deforming surgeries for malignancies and other conditions such as this. So, that is plastic surgery, otherwise known as reconstructive surgery. So, this also comes under plastic surgery. You can see that this patient has got his fingers amputated. You will see once in a while in papers, using microvascular techniques, plastic surgeons put the fingers back. So, that is so much so about what plastic surgery is. So, what is the importance? Why is plastic surgery important for us? If you are going to become a surgeon, obviously you need to know about these techniques, because you yourself will be applying it on various patients when you do cancer surgery. So, that is important for those of you who is going to become surgeons. Those of you who are going to take allied specialties like say ENT or orthopedics, you saw that patient with trauma in the previous slide. So, you should know that possibility, so that you know when to call a plastic surgeon to correct the complicated wounds that you may encounter. For all other doctors as such, of course, you should know something about it, so that you will be able to advise the patients who visit you with various conditions as to what this plastic surgery is all about. So, that is the importance for you. And as far as exams are concerned, yes, you can get a couple of questions from this specialty. We will see them as we go along in the class. So, we learned that plastic surgery is primarily about managing complicated wounds, and all of us as doctors, and especially if we take up surgery, will encounter wounds, and that is the main bread and butter of a surgeon. So, what are the various steps in managing a complicated wound? The first step is evaluation of the wound. Then after we evaluate, we prepare the wound for closure, and there are various closure techniques, and we need to choose the right closure technique for each wound. And the most important part of any wound management is planning. So, we will see all these things one after another in this particular class. So, evaluation. So, evaluation of the wound has to be done as regard to various points. One is where the wound is located. What are the possible underlying structures that may be damaged? Is there any tissue loss, or it is just a clean cut wound? Presence and absence of contamination, and the time since injury. So, these are the various considerations that you will take into account before we start managing any wound. So, let us see in detail about all these parameters that we will evaluate. First is the location of the wound. So, how is it going to matter where the wound is located? So, obviously, as you know, the wounds on the face and the hands are very important and unique. Face for obvious reasons, because of cosmetic importance, and that is the first thing that you see in another human being when you see the patient, when you see the person. So, any wound on the face has to be taken seriously, even if it is a small cut, superficial cut. You need to take extra care while managing patients with wound on the face. Hands are important because it is functional, and that is what makes human a human, his ability to use hands. So, it is of functional importance. It has got a lot of nerves, tendons. You saw on the previous slide a child with a cut on the hand. So, a wound on the hand has to be taken seriously and evaluated properly. The neck again is a very important area of the body. You cannot take it lightly, because it is the thoroughfare between the head and the thorax. Thorax contains the important organs of oxygenation, the lungs and the heart, and the head of course has the brain, and the neck contains all the structures that go between these two important regions in the body: the spinal cord, esophagus, carotid artery, veins, and so on and so forth. So, any wound in the neck, you should not just stitch and send. So, you need to evaluate those wounds carefully. Genitals are of course it is important, because it is a very sensitive area for human beings, and any wound in a location of a major vessel, say the axilla, the elbow, the groin, all these wounds has a possibility of a major artery injury. You may not see blood spurting out immediately, but then you need to keep the possibility that these patients might be having a major vessel injury. So, we are finished with location. So, now you know the importance of location as far as wound management is concerned, and the underlying structures. So, when you see this wound, it looks like a straightforward wound. Probably the patient has slashed their own wrist or injured the hand against some glass piece. It looks on the first look, it looks like a very simple injury, and then it is tempting for us to just suture it and then send the patient off. But on deeper exploration, you can see that the patient has got his palmaris longus tendon cut, the flexor tendons are cut, the median nerve is cut, and the ulnar artery is cut, and so is the ulnar nerve. So, if you had sent this patient off by just suturing the skin, you would have missed all these injuries, and patient would have been left to be a cripple for the rest of their life. So, to know what underlying structures are involved, the surgeon should have a thorough knowledge of anatomy. So, without the knowledge of anatomy, it is very difficult for you to guess what structures will be or possibly injured. So, that is the importance of anatomy as far as wound management is concerned. So, tissue loss, for example, this is a patient who presented to us with a injury to her face. Her son stabbed her in the face because she did not give him money for alcohol. So, this is a very simple wound. There is no tissue is lost in this patient at all. You can see that it is a clean cut wound, even though it has gone through and through into the mouth, and that wound can be easily managed. It does not require any special techniques, just have to close the wound in layers. So, it is simple to repair wounds without tissue loss. On the other hand, you see this large wound that is left on this patient's abdomen. So, there is no way you can bring the edges of these wounds together, and they will require more complicated techniques for you to close the wound. So, that is the difference between simple wounds which are clean cut with no tissue loss and wounds with tissue loss. Simple wounds can be managed easily by anybody, provided there are no injuries to underlying structures. By large gaping wounds will require complicated wound management techniques. So, again you can see this is a very clean wound, there is hardly any contamination. The patient's son was nice enough to stab her with a clean knife perhaps. So, the patient does not have any contamination in the wound, it is a clean wound. Contrast with this wound, this is a wound that the patient has sustained in probably in a road traffic accident, has been run over by a truck, and then you can see all the grime and dust and dirt and everything that is there in the road has been pasted into this wound. So, the management of these two wounds again obviously cannot be the same. Many times you will find agricultural workers who are run over by tractors, where all the dirt and dust and cow dung and everything will be in the wound. So, the management again is totally different. Management of dirty wounds are different from management of clean wounds. Again, it is very important for us to distinguish between these two wounds, because if you close a dirty wound, even though it looks like a straightforward closure without much tissue loss, you close this wound, what will happen is all the anaerobic bacteria and everything will start growing and the wound will end up badly infected. So, we will see that in the coming slides. So, all you have to remember is management of clean cut wounds are totally different from management of dirty wounds. It is very important to distinguish between these two. Then finally, the time since an injury. So, any wound that is of less than 6 hours duration, you can think about closing those wounds, because there is not much time has elapsed since injury. So, the chance of infection in these wounds are fairly less. You can stretch this time from 6 hours to 24 hours in case of wounds over the face and wounds over the hand, because as we have discussed, these are special areas and they have a better vascularity. So, they have better chance of healing better, even though the time since injury is up to 24 hours. But for in general, for all other wounds, 6 hours is the golden hour for closure. So, now that we have seen the various factors that will affect the management of the wound, namely the location, the injury to underlying structures, the presence or absence of tissue loss, the presence or absence of contamination, and the time since injury, how do we plan based on these parameters? So, if the wound is dirty, there is a lot of like we discussed, cow dung and vegetable matter and all those in the wound. Number 2, if there are large tissue loss, 5 centimeters of the tissue is gone, or if 3 centimeter gaping wound is there, or if the wound is more than 6 hours in duration, we will not close the wound at all. Let it be whatever wound, over the abdomen, over the face, or the leg, or the arm. The management of these wounds will involve only dressings and no closure. We will not close the wound at the time when the patient presents to us. Got it? So, if the wound is clean, if there is no tissue loss, and if it is less than 6 hours, we will apply one of the closure techniques and close the wound. So, this slide is very important, probably you can take a screenshot and keep. Dirty wound, tissue loss, more than 6 hours, dressing. If it is the other way around, we will adopt one of the closure techniques. First, we will see how to do this dressing, because that is most important. The patients with the dirty wounds are the ones who require the most attention of the surgeon. So, how do we dress a wound? The first is, you should have good lighting. Suppose you do that in a dark room, do the dressing in a dark room, you are not going to see this dirt and this vegetable matter and all the other things. So, you need very good lighting. You need to have personal protective equipment. This is a word that you are hearing very often these days. Obviously, you need to be protected yourself to give proper care to the patient. So, gloves are important. You need a plastic apron so that your good clothes don't get spoiled during washing. And this is the most important medicine that you are going to use on these patients. It is not antibiotics, it is not any of the other fancy drugs, it is good old plain normal saline. So, that is what you need for dressing. We need plenty of gauze pieces for applying on the wound after you give wash, and you need the bandage. So, you inspect the wound in good lighting. After wearing personal protective equipments, you thoroughly wash the wound with normal saline. We normally use for large wounds up to 2 liters of normal saline to wash it. Suppose normal saline is not available in the hospital that you are working, say if you are working in a field, then you can use simple straight clean water to wash the wound. Once you wash the wound, you apply gauze pieces soaked in saline again and apply the bandage. So, that is the management of dirty wounds with tissue loss and which is of more than 6 hours duration. As simple as that. This is again to remind you that the normal saline and the wash is the most important part of the whole management, because that is going to dilute the toxins, remove away all the bacteria and so on and so forth. So, washing with normal saline is very very important and we can't emphasize it more. So, now that we got dressing out of the way, so what are the various closure techniques that are available with the surgeon? The most important and the common closure technique that all of you would have heard of and we use it very often is suturing, where we just take a suture and close the wound. You can see in the slide. We can take a part of the skin from one part of the body, say the thigh, and place it over the wound. This is known as skin grafts. Then there are the local flaps, where we shift a part of the tissue from one part of the body to another. Then there are the regional flaps, then there are the free flaps. So, we will see what these things are about. These are the various closure techniques that we have discussed previously in the coming class in plastic surgery part 2. So, in this class we will primarily focus on suturing, because it is very important and every doctor should know how to do suturing, and this is one of the basic things that all of us should know. So, we will see that in detail in this class. So, what is the technique of suturing? What is the right technique of suturing? So, again for suturing, first of all you should have the right instruments for suturing, because that is going to help you achieve better results. So, you send a cricketer with a hockey stick, he is not going to go score many runs, isn't it? So, it is very important. Again, lighting is very very important. So, if you do not know, if you are not seeing what you are suturing, you are not going to do a good job at suturing, isn't it? So, we need good lighting. Then we need a table of the right height. So, if the table is very low and you are bending over, obviously your ergonomics are not good and you are going to get impatient and not do a good job. The surgeon should be comfortable, only then he will do a good job at suturing. So the table should not be very high, it should not be very low, it should be of the right height. The right height will be at the level of say that your work should be at the level of one's own hip. So we need this kind of tray to place your instruments. So this is a needle holder used for holding needle, otherwise known as a needle driver. Then we need a forceps to hold the skin while suturing. Then we need a scissor to finally cut the sutures. And this is a curved instrument known as the hemostat. So while you are exploring the wound, if you encounter any bleed, this instrument will help you catch the bleeder and control the bleeding. So that's the use of a hemostat. And we need a surgical blade, because many times at the time of injury the edges of the wound may be ragged. So in certain situations you might have to incise the wound, trim off all the ragged edges before suturing. So you will require a blade. So those are all the instruments that you require. And what about the disposables that will be required? Obviously we need local anesthesia. No patient is going to allow us to apply our closure techniques on them without proper anesthesia, and we need a syringe to deliver the anesthesia, and a needle, of course hypodermic needle. The common needle we use for local anesthesia and surgery is 22G. You can see it is a black needle. We need a central hole towel. This is just a sterile towel with a hole in the center. This is to avoid contamination of your instruments and the suture while you are applying sutures. Again the good old gauze piece. So those are the instruments that you require for applying sutures. And of course you need the sutures itself, isn't it? So there are basically two types of sutures you should know of. The absorbable sutures, which we place underneath the skin in soft tissues, in the subcutaneous tissues. These sutures will get absorbed on their own. Since we won't be able to remove the sutures which we place in subcutaneous plane, we use absorbable sutures which get absorbed on their own, and non-absorbable sutures. So absorbable suture, the example will be polygalactin or a catgut. An example of a common non-absorbable suture is nylon or polypropylene. So again these sutures come in various sizes. So smaller the number, thicker the suture. So 10-prolene will be much thicker than say a 40-prolene. So higher the number, thinner the suture. So you got to remember that. So again we use sutures of varying thicknesses for different parts of the body. So on the face we usually use a 4-0 or a 5-0 suture. So this is a fine suture. On the hand we will use either a 3-0 or a 4-0 suture. Generally for rest of the body we will use either a 3-0 or a 2-0 suture. On the scalp we usually use a 2-0 suture because scalp is a very tough structure. It will bleed profusely, so you need to make the sutures a little tight. If you use a very thin suture and make it tight, it will snap, so you want to avoid that. And cosmesis is not a big problem in the scalp because hair is going to grow over it and hide the scar. So that's it. So smaller the number, thicker the suture, larger the number, finer the suture. Where you require cosmesis, you use fine sutures like in the face, and rest of the body you can go with a 2-0 suture. The commonest suture we use on the skin is the nylon, in our institute at least. So what are the steps? So first is after you evaluated the wound and you have decided that this wound is fit for closure, and you have selected the closure technique and it happens to be suturing. The first thing we will do is give anesthesia to the patient, because he is not going to let you do anything before you give anesthesia to them. Following that, we thoroughly wash the wound of all the dirt or bacteria that could have been lodged in the wound. Then we clean the surrounding area of the wound with an iodine based solution. This is to destroy the microbes that are there in the surrounding area. Then we will place this central hole towel over that to isolate the wound from the rest of the area and to keep the area sterile. Then, like we have discussed, we will start the suture technique proper. So, in general, the finer the suture, the better is the result. The closer the sutures are placed, better it is. The suture should be put snug and not tight, because if you place the sutures very close and very tight, the blood supply to that area will get cut off and the wound will get necrosed. And the deeper layers, say the patient has got injuries to other structures like the tendon, the subcutaneous layers and the skin, all the deeper structures should be repaired first, and then the suture should be placed on the skin. So, at the end of the suturing, you should be able to get a wound that is everted. Everted, like in picture C. You can see that the edges of the wound are facing up, that is called eversion. In picture D, you can see that the edges of the wounds are dipping down, that is called inversion. So, our aim is to achieve eversion in these patients. So, how do we handle these instruments? So, there is a specific way of handling the surgical instruments. You can see here, this is the needle driver or the needle holder that is held between the thumb of the surgeon and the ring finger. So, most of the kitchen instruments that you might have used in your homes, you will see people handling between the thumb and the middle finger, but surgical instruments are designed in such a way that you should hold them between your thumb and your ring finger. This offers greater flexibility, and we have two fingers, the middle finger and the index finger, to stabilize the instrument. So, that is how you handle a needle holder. While a thumb forceps, like you see in this picture, is held between three fingers. So, there is a 3-point stabilization of a forceps. Of course, again we will be teaching you all these things when you come as interns, but you can just get an idea from this picture. So, it is held with 3 fingers. So, that is how we hold a forceps. Scalpel is held in a fashion similar to how we hold a pen, you can see here. So, that is how we handle the instruments. Now, how will you handle the tissues? So, we have learned how to handle the instruments, how to hold the needle holder, how to hold the forceps and the scalpel. So, how do we handle the tissues? One needs to be very gentle with the tissues, right? If you hold it with a lot of force, you will create a lot of injury, and the chance of the scar being worse is much higher. So, the tissues have to be handled gently and use the finest instrument that you can possibly use in that situation, right? And no crushing instruments should be placed on the skin. So, what you have to understand is the tissues have to be respected and handled gently. So, what are the various suturing techniques that are available? So, we learned about the instruments, we have learned about the general principles of suturing, like the finer suture, closer sutures, and to not to crush the tissues and handle them gently. So, what are the various suturing techniques that are available with us? So, in this picture you can see this is a simple interrupted suture. This is the commonest suture that a surgeon uses for wound closure. Probably I will try to upload some videos of suturing techniques which you can see at the end of this lecture. Then this is something known as a mattress suture. So, this is all again to give you a brief introduction to this. So, this class does not teach you exactly how you place these sutures, but just introduces you to the general idea of how these suturings are done. So, do not worry about that, we will teach you later. So, this is a continuous suture. You can see in the previous slide there were breaks between the suture. Here the sutures are placed in a continuous fashion over here, and this is known as an interlocking suture. So, these are all just various options that are available, and we apply it in various situations. and this is subcuticular suture. So, interrupted suture, then there is matter suture, these are the commonest sutures, and there are some rarely used sutures. So, that much you can remember. So, once you are done the suturing, your job does not end there. So, after suturing is done, you need to apply a comfortable dressing for the patient. Then in certain situations, the part of the body has to be positioned in certain way. In mostly if you have done suturing on the hand, the limb has to be elevated and kept to decrease the edema and decrease the chance of bleeding. And if tendon repairs are done, flexor tendons are repaired, then the wrist is kept in flexion, and so on and so forth. So, what you have to remember is this suturing is to be done, after that dressing has to be placed, and you have to give a consideration for any special positioning that may be required for a particular patient. And when do we change the dressing after we have done suturing? So, dressing should not be changed very frequently, because it produces discomfort to the patient, and every time you pull the dressing off, there is a chance that you disturb the wound and there is chance of disturbance of wound healing. So, we will say that dressing change is done as often as necessary. It depends on what is the chance of infection and how extensive is your repair and on many factors. But dressing change should be done only as often as necessary. If it is an uncomplicated wound on the face, probably you will change the dressing on the 3rd day, and again you will call the patient for suture removal on the 5th day, and that is it. So, now we have done the dressing, we have positioned the patient. When do we remove the sutures? So, it is not the same for all parts of the body. So, different parts of the body heal differently because of various factors, the stress on the wound, the vascular supply, the healing potential, and so on and so forth. On the face, we do not want to leave the sutures for too long because it will leave marks, and as we have discussed, face and the hand, they heal very well because of vascular supply. So, the wounds on the face can be, sutures can be removed on the 4th day. In the hand, in general, you can remove on the 5th day. So is the scalp, it is very vascular, again sutures can be removed on the 5th day. In the rest of the body, as a rule of thumb, we can remove the sutures after the 10th day. So, suture removal is based on which part of the body is sutured. So, that is what you have to remember. So, after you have removed the sutures, some parts of the body will require physiotherapy to recover, especially the hands. Again and again, the hands are very special and has to be handled very carefully because it is a functional part of the body. If you repair the tendon, patient will require rehabilitation, and you have to watch out for development of wound related complications later, like hypertrophic scars and keloids, which will be covered in a different class for you. So, that finishes this class. So, there will be a set of questions that will be sent to you. You need to answer them in order for you to get the attendance. So, in the next class will be on a little bit more complicated wound closure techniques, that is the skin grafts and the various flaps we discussed in one of the slides. So, that is about it. Stay at home, stay safe. We will see you in the next class.